Welcome to the Caregivers Podcast. I'm your host, Dr. Mark Ropeleski. You can call me Dr. Mark. Many caregiving stories don't begin with conviction. They begin with a quiet sense that something isn't right. Today's guest, Cynthia Neilson, learned that her daughter, Clare, was living with a rare and serious heart-lung condition, one that came with a timeline no parent is ever prepared to hear. This conversation isn't about diagnosis. Today's conversation is about what happens after, what you're told, what you're not told, and how you raise a child honestly without stealing their childhood. Cynthia, welcome to the podcast. Cynthia Neilson, welcome to the Caregivers Podcast.
Thanks, Mark.
Cynthia, do you remember the exact moment when you realized that this wasn't going to be a small or temporary issue with your daughter?
I did. I can remember it so clearly like it was yesterday. It was, trying to think back, it was 13 years ago, so quite a while ago. My daughter had an earache, so she was around 2 at the time. I took her to the hospital. They were, looking in her ears. She had an ear infection, pretty standard for a 2-year-old. But a med student came in and asked, like, "Oh, can I just do like a routine checkup on to practice like in the pediatric space?" I said, "Sure, no problem." And she started listening and she said, "Oh, her heart just doesn't sound quite right. I think I'm going to refer you to a cardiologist." I thought it was maybe overkill because, I don't know, she was a student and I'd never really there had been no other issues with Clare. And so we were referred to have an ultrasound done. And I think that was when the moment I knew things were going to forever be different. The ultrasound technician started doing the ultrasound and she said, "Well, obviously, Clare has a very large hole in her heart." And at that moment, we were unaware of that. And my heart sort of sank. And I looked at her, and I think she looked at me, and we had this moment of, I think she was a little stressed that she had relayed this information, and I was stressed hearing this information. And I knew from then things would be potentially different forever.
So moving forward a little bit then, so what was Claire's diagnosis eventually, and how was it explained to you in the room?
So Claire is a bit of a complicated diagnosis. So the moment I just described, she was diagnosed with a large ventricular septal defect, which they eventually repaired surgically. So we were sort of immediately sent to
So
sick kids.
that's a hole between the two main chambers of the heart, the two ventricles.
Correct. Yes.
Okay.
Yeah. So we were referred to sick kids. We saw them, I think, the next day. They did some exploratory testing. Yes, she did have quite a large hole. With that testing also revealed that she had pulmonary arterial hypertension, which is called group 1 pulmonary hypertension. It's basically when there's high pressures in the blood vessels going from the heart to the lungs.
Mm-hmm.
It's a chronic disease. It's a rare disease. There's about 2,000 to 5,000 Canadians who have it. That's the group 1. There is 5 groups. And so her diagnosis was, I guess, those 2 things. The plan was to surgically repair the hole with the hopes that the pulmonary hypertension would resolve itself. In terms of how it was communicated to us, we obviously were already aware of the hole. It was nice to have like a bit more of an explanation. They assumed she was born that way. The pulmonary hypertension was idiopathic, so they didn't know what caused it. I would say
And it wasn't caused by the hole.
They don't know. They kind of described it as like a chicken and the egg. Did the hole create the pulmonary hypertension, or did the pulmonary hypertension create the hole? Like, I think it's unknown. They did a really good job of explaining in sort of like layman's terms what was happening and what the diagnosis was.
Mm-hmm.
We were also immediately assigned a child life specialist. They have a team at Sick Kids who work with children and explain things in very simplistic terms and then support your child in various tests throughout. And they entered the room as well. And I mean, it's great for kids to understand things in a easy way, but we also needed it as well. I needed to hear it a few times. But it was good. I felt really well informed, which was reassuring. I think I'm like a knowledge hungry type person. So knowledge was power to me at the moment.
Especially with your daughter there.
Yeah.
And that was at Sick Kids Hospital in Toronto.
Yeah.
So our listeners understand when we talk about pulmonary hypertension, the right side of our heart part pumps blood to the lungs. And when there's high pressures in the vessels of the lungs, the heart has to work a lot harder to get the blood there. And it has effects on the heart. At some point in that early conversation, timelines must have entered as a topic. What were you told even then, or could you be told anything to assuage all the racing thoughts about how long Claire might live? And what was the scariest part of that conversation as a young parent?
Yeah, that was my very first question is she going to survive this? We I would say medical professionals tread cautiously when giving time frames. I kept hearing the phrase, "We don't have a crystal ball," which, I guess is reassuring but frustrating as a parent. I think you just want the answers, and it wasn't that simple. They had told us that they wanted to go in and close the hole, and that if we did not pursue medical intervention and do that, her lifespan would be around 12 years. What their recommendation was to go and put her on a course of medication for approximately a year because at the time of diagnosis, the pressures were too high in her heart to actually safely do open heart surgery. So the idea of waiting a year to wait and see how things were going to be and if surgery was going to be possible was extremely frustrating. It was anxiety provoking. It was like an emotional roller coaster. They did say, and then I obviously asked the question of, if we do the surgery and things go well, what will her lifespan or quality of life look like then? And at that point, they couldn't really provide an answer. They said, it's unpredictable. It depends on how the surgery goes. There's a lot of factors. She's young. Things will change with growth. So that unknown, I think, was probably for me the worst part of it.
So that year of waiting on medication, with the medication hopefully reducing the pressures and the strain on the heart, there were so many conversations. But in the days that followed after some of these conversations, especially early on, what was the first memory you have of ordinary moments that suddenly didn't feel ordinary anymore when
Mhm.
thinking about your child and your family life?
Yeah, I can remember a couple of days after we'd come home from the hospital after, quite a few days of tests, and I was pregnant at the time, and I was exhausted. And I remember putting Claire to bed, and bedtime was always like a very fun and like joyful time. My husband and I both work full time. So, she was in daycare at the time. That window of when you return home and when they go to bed is very small at that age.
And
So it was
special.
usually, yeah. So it was usually filled with uh, negotiations about dinner, bath, book, all those things. Bedtimes looked extremely different in those early days. So Claire had been, she was using oxygen at night, so we had to explain to her, what this machine was. She was, tethered to this machine that she couldn't get herself to the bathroom. We had, they tape, sort of use medical tape on small children so they don't pull it off. So there was, all this equipment on her. There was an entire routine around medication. It felt like the hospital had, invaded my personal space. Like, bedtime felt like a medical event. And it just really I kept having thoughts about how many more day-to-day activities are going to look like this, and how can we as parents, my husband and I, make things feel as normal as possible for a 2-year-old who really has no comprehension of what's going on, and those conversations were kind of meaningless at that time to her and with her.
Before Claire's diagnosis, you've said before that you had a gut feeling that something wasn't right. Looking back now, what were you noticing that you just didn't have a language for to describe it at the time?
Yeah, I've done a lot of, reflecting on this. I think I was a first-time parent with Claire. I think when she was born, I tried breastfeeding. I was unable to breastfeed. We spent a lot of time with a lactation consultant at the hospital, and they kept saying, "We're not sure what's going on. She just doesn't seem to want to she seems like not strong enough, or like she's just not trusted in eating. I thought, okay, I guess maybe some kids just that's just how it goes. I didn't know what I didn't know. So I felt like this seems strange, but that's fine. She also was like not hitting developmental milestones like other children. So she never really crawled. She did walk, but it was a bit delayed. I would say she slept all the time. So I remember I had, other moms who had children the same age, and I was hearing all the horror stories about like sleepless nights and colic, and they were exhausted. And I was like, I don't know, Claire just sleeps all the time, like 24 hours a day. Like I have to wake her to feed her. And they're like, oh, you're so lucky. But I mean, in looking back, like I was not so lucky. Like she was just so weak. And then I think that was the determination around breastfeeding. It just takes a lot more strength from a baby to breastfeed than bottle feed. And so she just didn't really have the stamina. At one point, I just felt like, I don't know, she just doesn't seem quite right. And of course, I talked to our pediatrician and he said, oh, no, you're just a first time mom. You're just worrying. And I thought, okay, yeah, no, I'm paranoid. I'm sure everything's fine, and let it go. And then, things just kind of carried on. I mean, I wish I knew what I knew then, but I would say like medical intervention was still pretty timely for us. Um, However, if we had known what we knew, they probably would have repaired the VSD in utero. So we may have had better outcomes with the pulmonary hypertension, but we might not have. It's so hard to know, but yeah, I just felt like something wasn't quite right. But it's hard as a first time parent. You're
Absolutely.
so exhausted
You're
already.
second guessing yourself. You're
Yeah.
tired. Am I overreacting?
Yeah, I was
And
pregnant, so I thought, "Oh my goodness, the hormones and and all the other things, like, it's just in my mind."
Cynthia, what happens inside a parent? We think now between years 2 and 3. What happens inside a parent when the future you had been quietly imagining for you, your family, for Claire suddenly collapses?
I think there was, like, a whole host of emotions, and I think every day brought on an unpredictable feeling. So I think it started as, you know, shock and numbness, to I have a very sort of like type A personality. I was like on the path to like getting the answers and putting all the things in place, sort of on that autopilot, and very effective at compartmentalizing. I think for me to survive that year, it couldn't be front and center in my whole world. Um, I had a lot of doubt and blame about, did I cause this? Is there something genetic in my body or my husband's that has created this? There was fear, guilt, anger, like, why me? I'm a healthy parent. I don't smoke, I don't do drugs, I drink relatively little, I exercise every day, I eat healthy. I try to balance work stress. Like I felt like I've done everything I could do to produce a healthy child, yet this has happened. So I think I was frustrated. And I think to cope in that year, like I said, I did a lot of compartmentalizing. I was still working full time, as was my husband. I was pregnant. Um, and I think I started seeing a therapist. And that really helped. I'm fortunate that I had really good social support. So I was really in it with my husband. Um, at the time, we both had living parents. None of our family lives in Toronto, but quite close, just a couple of hours away in Ontario. So we had that network. I had like an excellent community of friends. And so I think I just really tried to learn to lean on people when I needed to. And it was every day brought a bit of a different experience. But I think a part of you just, I don't know. It's a worry that will sit in my head all of the time, and just trying to manage that, day to day is, like, something that I just have to work on and get through.
Although 12 years out, looking back now, what do you wish you could say to yourself in those days back then? If you had to give yourself advice.
Yeah, I think I would tell myself to give myself a bit of grace. I think I probably didn't take the time I needed. Like, I didn't take time off work. I mean, I took obviously days here and there, but, like, I probably needed to just step away a bit from life and reflect and get away and regroup. But instead, I sort of like pushed through and, made the to-do lists and went on autopilot and compartmentalized and did all of those things. And I wish I could have just maybe been less numb and felt a bit more. Um, and I would have these triggering moments where I would go into the hospital, or I would, see a kid playing, or a healthy child, or I'd see there was this one thing, and I always come back to this. Remember watching a commercial when people watched commercials, and I don't remember who put it out. I think it was a mental health organization, and it was a woman in an elevator, and she kind of gets in and she's like taking up a lot of space. And the other woman is looking at her kind of like growly, thinking like, oh, she's taking up all this space, and like, what, can she be more respectful? And then it shows like what's actually happening in her life, like this sort of woman that gets in, and it shows like, her dad was sick, her mom had health issues, she had just lost a child, and the caption was like, you never really know what's going on in other people's lives. And I felt like in that moment I was that woman. I was pretty private about what was going on, and my colleagues weren't aware of sort of all of the details, but I felt kind of trapped in my body. Like, I had all this information on all these feelings, but I didn't want to, like, I don't know, burden people. And I think that really has still sits with me today. I think over the 12 years, and I'm sure we'll talk about sort of how things have evolved, I've found different ways and different outlets to sort of cope in probably a more productive way than in the early days. And I wish I would have had this same kind of insight, but I think hindsight's 2020, and I was just so in it at the time.
You know, hearing so many stories and reflecting even on my own life, it's amazing how self-directed kindness, self-directed compassion, grace towards oneself is one of the biggest challenges when we strive to just keep it all together.
Yeah. Yeah.
Claire was young. She was very young. At the beginning in those days, as she started becoming more aware, how did you go about deciding what you were going to tell her and not tell her as she became more aware?
hmm This was really tricky for us. I didn't really know how to um, speak to her in like an age appropriate way, and like at what stages what was appropriate. I would say we really leaned on the child life specialist that we worked with at Sick Kids, and they do have kind of like a resource that shows like, at this age you should be talking about this, and at this age you can start talking about this. And I took a lot of, honestly, cues from them. We're also lucky in the cardiac department that Claire is a patient. Her nurse practitioner has been with her since the very beginning, so since the point of diagnosis and until today. We're still with the same nurse practitioner,
That's a
and
powerful
oh my God,
relationship.
fantastic. Claire and her are so close. Actually, they actually went to a national conference a couple months ago and presented together. It's definitely a powerful relationship. But I took a lot of cues from her too, because I think she could be a little bit more objective, and does this every day. So I think we tried to just like get good advice from people, and I also took my cues from Claire. Like, I think at the beginning we told her very little, other than like, we had to explain why she was wearing oxygen. And I had this moment, and this is another moment that I'll never forget. Claire was maybe, I don't know, 7 or 8, and she wanted to sleep over at a friend's house. And we said yes, she could bring her oxygen. We knew the family very well. And Claire got into this girlfriend's room, and she said, "Oh, where's your oxygen machine?" And it was at that moment that it struck us that Claire actually thought every child slept with oxygen. Like, that was the norm for her. So, I mean, that was a bit of an eye-opening moment, in that, like, okay, you know what? Maybe these like age-appropriate conversations haven't stayed where they needed to. Um, Claire is a very curious child. She's quite extroverted, and isn't afraid to ask questions. So our cues a lot came from her. So she'd say, "Why do I still have to take this medication? Didn't they like sew up my heart? Like, this is still a lot of stuff to take." Or, "I have to go to the hospital and get blood every month. Like, why is that? What are they looking for inside of me?" And so I think that was a good cue for us to be able to respond. But it's been tricky. And I will say those like adolescent years, like 10 to now have probably been the hardest. More difficult conversations, more questions that um, are come out of the blue and kind of throw us off. And it's become more challenging actually to like evolve with her than I was expecting.
You mentioned the word we often, and I surmise that's you and your husband who are making those decisions and those early little steps and journeys together.
Mhm.
But how did you accomplish that, especially if you might have found yourselves with different coping mechanisms emerging?
Mhm. Yeah, unfortunately for us, Claire's sort of course of treatment and action was very um, derived from the medical team. And so we didn't have a ton of flexibility in medical decision making. So the two of us didn't really have to compromise on that. It was kind of like, this is the option that we're recommending. And we both agreed that to take medical advice sort of as a team. I think some of the negotiations at home, I think we were pretty aligned. We had like, again, like if we couldn't agree on something, like I'm a little bit more, I don't know, of a worrier or a bit more risk adverse maybe than my husband, but I would say, okay, let's just ask the NP or let's ask the child life specialist what they think. So we often did rely on sort of like an outside source to sort of help check that. But I think it was just a lot of like open communication, negotiating, and getting Claire involved in the conversation. Like it really was a team effort. I can't imagine what it would have been like doing this on my own. And there was moments where he needed to step away and I needed to step away, and having that break was like, I don't know, a godsend. Like, I think there was just times that your mind does go into dark places and you want to show up for your child in a way that's not so scary for them. And being able to balance that between the two of us and or friends, like we may call someone and say, the two of us need a night out. Like, can you just come over and spend some time with the kids? Because I had two at that point. And we just really we needed to be able to ask for help outside of the relationship between the two of us.
So important to ask for help, and often help is at you there and waiting, but we never ask.
Hmm.
Was there a moment where you realized that the story you'd been telling Claire needed to sort of frame shift as she started getting older? Was there an evolution?
Yeah, I think so. I think that the evolution was a lot of the time tethered to like, I don't know what I say is like milestone moments or like bigger events. So a good example is like the transition from school to daycare. And so we knew when she entered school, we were going to have some of these conversations with her. So you take medication at lunch, but most of your friends won't. Um, your bedtime is a lot earlier than other kids' bedtime because you need more sleep. I mean, because at school you start talking about, oh, did you watch the show or what time do you go to bed? And so some of those, like when she became more of like I mean, she's always been social, but able to like, engage with friends independently, we had to have some of those conversations more. Another great example is COVID. So Claire was in grade 4 when COVID happened. It was a scary time for us. And when people started like, okay, well, we'll just like increase our bubble a little bit, or we'll take this calculated risk, or we won't do this and we won't do that. Like we had to always be stringent on the strict side. And Claire was like, it's not fair. Like my two friends are at the park together and like, why can't I be there? And I think like those triggered conversations that revealed or provided more depth into like the seriousness of Claire's disease. I would say the most recent one, and this was something that I had anxiety about maybe since the point of diagnosis, is at what point is Claire going to realize her life trajectory is not the same as her friends? And I became involved with like the pulmonary hypertension community a couple of years ago. I just wanted to seek out people who were going through the same thing as me. It took me a very long time to get to that point. I was very reluctant to enter that space, and I kept Claire so firmly away from it. Um,
Hmm.
I was can vividly remember the first family conference I attended, and I looked around and everyone looked sick. They were on oxygen, they were in wheelchairs. They had all the classic, more advanced symptoms of pulmonary hypertension that for Claire, if you just looked at her, her disease is fairly invisible at this point. And I thought, oh my God, if Claire was with me, she'd look around and this is her future. This is what her future is going to hold. And I just couldn't face that until in the last few years. Um, I realized I became a director for the board for the Pulmonary Hypertension Association of Canada, which is a national not-for-profit organization that supports patients and families. I got really involved in that community. And it was through that I realized Claire actually needs to make the decision on her own about how much she wants to know and engage with people who have the same disease as her. And that has triggered a whole other host of conversations. So I think it's been these sort of like pivotal moments or milestones where conversation and openness has shifted.
So, how do you decide then how much truth a child can carry at these different ages and stages without overwhelming them?
I think it's trial and error. Like, I think you're going to
To
say
take the
too
leap.
much. Yep, you're going to take the leap. You take the leap and you're going to say too much, and they're upset, and you deal with it and cope with it. Claire regularly sees a therapist and they can process it. And then there's times you don't say enough and then they learn it on their own anyways. I think as Claire gets older, I mean, she has information at her fingertips. It's just a different generation. And the concern is if she goes off exploring on her own versus hearing it in a sort of a controlled environment with good advice, taking the leap and getting ahead of it from at least that is the way we have handled it, has, I think, been helpful. But sometimes I do worry, like, oh, maybe she doesn't need to know this yet. And it's tricky. I think it depends on like the maturity of your child and what they're
Hmm.
asking. Again, I've just tried to continue to take my cues from her. And if I see she's like, poking around online looking at, I don't know, like, what's the life expectancy of this? Or I just try to get ahead of it.
Was there a point when parenting stopped actually feeling safe, where you found yourself constantly watching for something, a sign that something might be evolving towards going wrong with Claire and her health?
Yeah, I think it was also tied to these like developmental milestones. And like my husband and I always agreed that we would try to support Claire to live a life that was as full as it could be and provide her with all the opportunities other kids have and just in a more creative way, maybe. So, to give you an example, Claire really wanted to go to overnight camp. Kids go to overnight camp, her friends we kept hearing about it. I was like a bit reluctant. I had like the fear and like what happens if, she gets into trouble. And, a lot of the summer camps are, in like northern communities or in areas that, healthcare isn't as like readily available. And so I was making decisions out of fear. And at one point, I remember said to me, like, I know you're worried, but I can do it. And I know I can do it. And so I said, okay, you know what? Like, let's just figure this out. And I researched, like, oh my goodness, you don't even know, like 20 camps. Um, I found one camp in Ontario that was going to allow Claire to bring oxygen. This was sort of the hiccup for us. They had never had a child with oxygen before, but they did have a full-time physician at camp. They said, okay, we're comfortable with going down this path. And so we made it happen. But I think it was like in these sorts of moments where my fear was starting to stifle Claire from being able to do things that she really wanted to do. And I was making decisions for her that maybe in the early days I needed to. I am the parent and she is the child, and she doesn't have
Sure.
the knowledge to do that. But as she gets older, I make decisions and she pushes back and says, like, let's think about that. Travel is another one. So I was very worried about her traveling. So she needs to bring oxygen on the airplane, and then to the destination we go to. And it was sort of stifling vacation. Like I was worried about like, oh, the flight. And she said, like, we can do this. Lots of people travel with this disease. Like, and I think we figured it out. But I'm really glad that she pushes me, my husband pushes me, because I think we could live a life of just like feeling stuck and being a little bit unable to like move forward and live. Like, I think that is what I keep coming back to. Like, I think we need to take some chances and just like allow her to be able to try to lead a life that she wants to lead. Like, in 2 years, she will not live in my home. She will be out in the world. And the thought of that is terrifying. But we are trying to do everything we can to set her up for success, to be able to make those decisions and have the conversations and educate the people around her in our absence. And that has been like a real hard thing for me to do.
What I'm hearing is that these normal childhood milestones and experiences and family experiences suddenly become like stress tests.
Oh, yeah.
Did you find yourself in that position as a mom where you were just all eyes and ears open waiting for something to go wrong? Or as you started and engaged in going through some of these experiences, aka stress tests, did you actually feel empowered?
Um, I'm not sure if I'm there yet. I think I still am failing a lot of stress tests. Um, there's Claire's in high school now. Entering into high school created a whole other host of things I never thought about. The conversations around vaping and drinking and parties and medical alert bracelets and all the things. I think it's really about like relinquishing control. And I think the stress test of like, staying up at night until she gets home and like walking around with my phone. And I don't, I think, I don't want to speak for other parents, but I think regardless of the health of your child, every parent worries and you'll worry about your child forever. It
Uh-huh.
just looks different. I think I do have this, like, I think every small little change or things outside of my comfort zone do feel like a stress test. And it's a lot. It's a lot to carry. It's overwhelming. It's emotional. It's trying to be able to like, talk myself into like it's going to be okay but it's a lot and it is I don't know if if it gets easier. I'm not sure.
Tell me about how it affects you emotionally on an ordinary day. Not one of those stress test days, but just an ordinary day.
Yeah, an ordinary day, I would say some days, I mean, we're in such a routine on like, put the oxygen, take the pills, make sure the lunch is packed, get the steps in. Like I think we're in like a good groove and on a day-to-day basis, I would say the fears and the feelings aren't front and center for me. Um but there are days where there's a trigger, whether it's a medical appointment, we see some sort of deterioration in her health. She's, I call her a freak. We call her a frequent flyer at Sick Kids. And when we're there for like a non-emergency routine thing, I still have like stepping into those four walls of the hospital is like anxiety provoking. There is a lot of feelings there. And I think on an ordinary day, I think things are okay. Like I can manage it. And like I said, just leaning on social support. I would say getting involved, like I mentioned before, in the PH community, when I have those like ordinary days that still feel kind of like sad and rough, I can like reach out to I don't know, Claire and I describe them as like her people, like the people that really get it, that live day to day with the exact same thing. And I think having that community really helps on the ordinary days. I would say, like in the days of crisis, it's like all hands on deck, bringing people in to help. Recently, my daughter had a hospital stay and it was a scary time. It was like we'd had a lot of ordinary days consistently. And you almost sort of, I mean, this is a great thing. And you sometimes I forget that she's sick. And, I have an 11-year-old son and they interact and I don't think about it. And then you have these moments where, she's in the hospital and my husband was traveling for work. And I thought, oh my goodness, I have a really sick child. And like, it brings all the feelings back, and those ordinary days following the crisis days are tougher, but you kind of just settle back into a routine. I think as a caregiver, you just really need to come up with ways to cope and to like reflect and to digest and like give yourself a bit of grace when you have those tough days. It's a lot.
Can you maybe share with our listeners how you need to sort of approach processing the fear, the grief of the moment so that it doesn't just quietly take over your life?
Yeah. I think I do it in a few ways. I think I was resistant, like I said, I was resistant to entering into that community and hearing people's stories of others who have the same disease as Claire. And I think as I've so part of the way I've kind of coped is just learned more and really understood like what does life look like in the long term for people with this disease. And I think that's been the pathways and the stories vary a lot. And we don't have a crystal ball, and I don't know if she's going to be like this person or this person or this person or none of these people. So I think that has been one way, like really getting involved in that community. I would say the community is very I really focused on the patients in that community in the beginning, and I think my shift in focus has been to connect with the caregivers in that community. And so, with every patient in that community, there is caregivers surrounding them, whether it's, medical caregivers or family caregivers or partners, et cetera. And we've developed like a community. We're all going through the same thing. And I think um, the power in just talking to people who know exactly what you're going through has really, really helped. I think, other things that I've done is like I'm a firm believer in, physical activity, and it is an outlet for me. Like I need to exercise every single day. I need to be outside every single day. I think some of those like self-care things. I know in myself when I start becoming like angry or like short with the kids or frustrated, or I can't concentrate at work, I know I need a bit of I need to take a step back. Like I need to, have a longer conversation with my therapist, or I need to like take a vacation, or I need to just step away from home life. Whether that's a day or two, or like getting to the cottage for a weekend and seeing my parents. Like I think I've become really good at reading my own personal cues and taking what I need. But it's taken me a long time to get here.
There's a huge moment here, and I heard you say it, and it just sort of resonated. You said, I need to do these things. You didn't say, I have to do these things on the list because those are the 5 things I need to do, or that they say I need to do, or I should do. But I heard in you, I need to, and because those things are custom fit for you and they work.
Mhm.
And I think that's a huge message for caregivers everywhere who are listening, no matter what vocation, or whether you're parental, whether you're looking after a senior in your family, whether you're a professional caregiver doing shift work, but it's what I need
Mhm.
that's I can choose and that's going to work for me. And I think that's a priceless realization.
Mhm.
Uh, the other thing I'm hearing from you, which is really important and it resonates, is community. And
Mhm.
I've spoken to many people now, and it's always the same thing. Find the community. If you can, and if it's geographically distanced, use the tools that we
Mhm.
have now, including groups that gravitate towards each other on social media to be able to provide that kind of community support, even though they're spread across long
Mhm.
distances.
Mhm.
I've heard
Yeah.
stories of friends who've met in these media, in these communities, who never meet in real life,
Mhm.
but are very important in providing support for each other as caregivers dealing with their different journeys.
Mhm. Yeah, absolutely. I mean, like, as I mentioned earlier on, Claire has a rare disease. So, I mean, 2,000 Canadians have what she has, and that is across the lifespan. In the pediatric population, you can imagine it's even tinier. And so finding your people is much harder. Like, I don't have people in Toronto that I can regularly see, but like you said, developing that network, whether it's virtually, has been really powerful. And, there is a national conference that PHA Canada hosts annually, and it's the time that I get to see these people in real life, and it is magical. It is, I've been to a couple now, and I brought Claire for the first time this fall, and seeing that experience through her eyes was like nothing I ever imagined. So I'm glad in that instance we took the leap of faith.
You've taken many leaps of faith. You've set or gone through milestones. You've learned how to live with fear. But over time, what boundaries with other people and other groups or other thinkers did you have to eventually set, even if it meant saying things to people that they didn't want to hear, but all with the goal of sort of protecting Claire?
Mhm. I haven't had to set a ton of boundaries, I would say. Like, I think because Claire was so young when she was diagnosed, the, like, boundaries that I set with, like, grandparents, like my parents and my husband's parents, because they, would take her for a week or two, um, was pretty easy. Like we were all kind of in it together from the beginning. I would say boundaries at school were challenging. Um, Constantly be feeling like you need to educate the people that surround your child on a day-to-day basis is exhausting. And I think Claire holds a lot of that burden now. Being, 15, she can certainly advocate for herself. But I think the biggest boundaries has been boundaries with Claire, and trying to we establish these boundaries and whatever these rules, and we always are saying like we're doing this in the best interest of you and for you, and she's a teenager. Like, they don't like boundaries. They don't want to be told what to do, and that has been really challenging. She pushes as she should, and it's hard to know, like, have I set a personal boundary that's actually unreasonable for her, and because I have lived a decade of boundary setting and fear, or can I just relinquish a little bit and take my lead from her? So I would say boundary setting with her has actually been probably the toughest, but in my surroundings, it hasn't been that bad. I would say I have my friends, and my social support group are very respectful of boundaries. I think they know when to check in and ask me if I need help. And um, I think my friends say to me, I think I can be a little bit robotic or stoic in these moments of crisis, as we talked about. And I have heard many times from many of them to say, it's okay to just be upset. Like, you can just be mad. If you want me to come over and you want to just cry the whole time and you not be good company, that's okay. And I think just understanding the boundaries and having friends that can respect that sort of emotional connection that sometimes you need is really important. And I think if I had friends that couldn't respect some of those boundaries around mental health and being emotionally intelligent, I think, well, we probably I wouldn't have stayed friends with them. My friends would have had to have changed based on my boundaries, but I'm fortunate that my social circle is so supportive.
It sounds like they help keep you visible and they
Absolutely.
prevent you from going numb.
Yes, yes. And accountable to say look, this is, as I mentioned, my daughter was in the hospital last week, and just even hearing them say this is scary. Like, it's okay to be scared. And, I'm reorganizing my life of I've got to get my son here and this, the here and this there. And they're just none of these things are important. Just be with your daughter and we'll figure it out. If the garbage doesn't go out on Wednesday, it's not the end of the world. And sometimes I just need to hear that reality check of you need that. I think that is, as a caregiver, your to-do list is constant. It is, you're adding to it and you're just on autopilot just to get through all the tasks. I think there's an additional load with a caregiver. You have your everyday life of your work and your family and your other children and then you have this huge other piece that sort of sits on your shoulder, and that's filling prescriptions, attending medical appointments, negotiating with teachers, negotiating with her, trying to think about the long term and the present. And there is this mental like rat race in your head. And keeping that race quiet day to day is work. It takes practice. And for new caregivers, it is the hardest thing, I think, that I experienced.
You go, and it's such a huge challenge when you're going from a protective mindset to preparing your child to actually have a voice and to be able to speak for herself. With the experience you've been through so far, what advice would you give parent caregivers out there navigating this journey?
This has been a hard one for me, I will admit. So I'm lucky. So when Claire goes to medical appointments, it starts with she is playing in the corner and is not even a part of the conversation for, age appropriate reasons. And then it was, no, Claire's now going to sit and she's going to listen, and we're going to do that. Then it evolved to Claire is going to sit and listen. And my goal with Claire is to say, during the conversation with the medical team, you're going to ask a couple of questions. And it started with things like, I can vividly remember the first question she ever asked was, what are you going to have for dinner tonight, to our cardiologist. Totally unrelated to the conversation. She also at one
Priceless.
point asked if he had a dog, what his favorite color was, but she was still like developing a relationship, and that was all part of it. And then it evolved to like, okay, now we're going to transition to like medically relevant questions. So she might say, sometimes in the morning, I feel like a little bit of extra, I feel extra tired when my oxygen isn't on at night. Like, why do I feel that way? And we started just like evolving. And then it was, I'm going to sit in the back and Claire is going to participate and speak in the meetings. Now it's, I come in and the NP and the cardiologist say, like, get out of here, mom. Like, Claire is going to, and of course, there's always some like follow up questions, but that like, if forcing, twisting my arm to evolve has been the best thing and the hardest thing for me. Recently, when we were at the hospital last week, we went and saw a different specialist. Claire also has von Willebrand disease, which is a disease that causes it. It's challenging for her blood to clot. It's like hemophilia, but a bit different. And so we were talking to that team, and of course, I'm on autopilot. They ask me a question. I'm sleep deprived. Or they ask us a question and I'm talking. And Claire looks at me and she says, excuse me, I think I can answer these questions about myself. And so it's in that moment that I was like, yep, okay, no, I got it. And I'm like, that moment, I'm really mad at her because I think I can answer better. But then I'm also like, I've done my job. I have accomplished exactly what we have been working on for 12 years. Like, she wants to advocate for herself. Does she do it perfectly every time? Absolutely not. She's 15 years old, but we'll get there. And I think as a caregiver, it's like you need to really think about what your role as a caregiver and what is the role of the patient in having a voice. And I think, like, my advice would be that those two voices are extremely distinct and not one more important or more powerful than the other. There's a time and a place for both. And tethering between those is challenging as a caregiver of a child. Yeah, so it's
What did it feel like the first time you heard, "Mom, we need you to step out," or "Mom, can you go in the hall? We need to speak to Claire alone."
I was mad. I was not happy. And I was like, what? She doesn't have all the information. Like, I know the answers. I've been on this journey. I do this and I do. And I made it about myself, and it has nothing to do with me. It is about her, and it is about empowering her. They have her best interest. The like very, rational part of my brain understands all of this. But the emotional part, I was just like, I know I am the caregiver. I am so it was frustrating. It was like a bit of a like hit to the ego. I'm not gonna lie, but it's good. Like we need to get there. And she's going to transition to adult care at 18, which feels like it's far away, but it's not. We've already started doing. There is a transitions program between Sick Kids and Toronto General Hospital for patients like Claire, and we're already starting to build up to milestones to make that transition. Because when she's 18, I will not be in the room. So I'm mentally getting my head around that in preparation for this. So it's it's tough, but you get there, I think, as a parent.
Sounds to me like she's already starting to take steps towards ownership of her own journey and her illness,
Yeah.
and which is such a huge thing. We do see lots of transitioning in chronic inflammatory bowel disease, where we spend a lot of time speaking about how you're in charge of you now, or you're learning to be in charge of you, and we count on you to be in charge of you. And it is, I can only imagine in Claire's case, a process that does need to start 3 years before, because there's so many steps involved. So she's 15.
Yep.
Driving lessons next year.
Oh God, don't remind me. I told my husband I want nothing to do with those.
Well, so with so much independence, though, I mean, there potential independence. At least there's a risk of real medical risk. How do you avoid protecting your child, Claire, so much so that you don't actually make things shrink in her life?
Yeah, I mean, I think that's been like our lifetime goal and biggest struggle is to like, and I think I had said this in the beginning, like we wanted her to live a life that was as full as she could live within like the medical boundaries that she has. And so I think we've become very good, and she's become very good at like looking for alternatives in her life to still feel fulfilled and doing things like her friends, but maybe doesn't look like her friends exactly. So, a good example is, my son is very athletic. He loves sports. He's, plays very competitive sports. And my daughter's really never been able to play organized sport. She just doesn't have like the cardiovascular stamina to do that. So we explored like what does like fun feel like in your body? What does it look like? What do you like to do? And she got really interested in art. So, she started drawing and painting and doing art lessons. And, she's a fantastic artist. And I think we just tried to like really normalize that like everyone's journey and interests and life path are going to look different, whether you have a chronic disease or just different interests or however it may look. So I think that's what we've really done to not sort of shrink her life down and try to like be really, realistic with what she can do and not do. And, just have some of those frank conversations, I think. Like, I think even, if her friends are like, going out for a couple nights in a row and I'm seeing that she's getting really like worn down. Like, I really don't want to, stifle her ability to be social and have a teenage life. But like to your point, like there is a point in which we need to sort of medically intervene to say like, you're going to start seeing some pretty nasty effects if you don't rest and eat properly and get some exercise, et cetera. And so we tried to tread lightly and try to keep that balance and just find alternatives to be able to prevent that sort of like shrinkage of life.
In the face of that, though, what's it been like to have to slowly hand over that responsibility for explaining her condition herself from you to now to her and then to her peer group?
hmm I would say that it's been okay in that we, again, like through that transition of explaining, brought Claire in like an age appropriate way. So, I would have the conversation with the teacher and Claire would obviously be absent. And then we would graduate to like when I sat down with her classroom teacher that year, Claire would sit in and she would hear what I was saying to the teacher. And then I was like, okay, the next year I said, we're going to meet with the phys ed teacher. You're going to tell her or him what is going on and what they need to watch out for. So Claire would say, um, when we do laps around the gym, sometimes I need to stop and you need to not yell at me and tell me to keep running because I feel really tired. And I would say to Claire, I need to prompt her a little bit to say like, what does that look like? And she would say, my lips go blue and my heart beats really fast and I feel dizzy. And that's when I know I need to sit down. So we sort of did it like incrementally. So we tried to sort of model that how to have those conversations. And then she sort of slowly stepped in to have them herself. And now she's in high school. I don't call her high school teachers and educate them on her disease. She does that herself. But there is moments like, she took phys ed last year where, the teacher was like doing some things that I wasn't thrilled about and she was trying to advocate for herself. But there is moments where we do get involved. Yeah, I think it's like she's been able to really explain her how she feels and what she needs in her own terms. The other thing we did, as I mentioned, we attended conference together in September, which was the first time that she calls them her people. She met her people, and she spoke on a panel as the keynote. And I was like pretty worried about this. I was worried like, what's she going to say? What kind of questions are we going to get? We did it as a team. There was a couple of caregivers actually and patients, and it was really interesting. And I was like, wow, she gets this. She can really articulate like what is going on with her. And I remember someone asked a question and of course, my inclination was to answer and Claire like kind of did hit me and she answered it. And so I think she's like gotten better words to be able to articulate what she has to others as she hears people like her explain what's happening. So I think she's just getting the words and the vocabulary as she gets older and just has that more readily at her fingertips.
Sounds like a beautiful emergence of empowerment.
Yeah.
Hats off to you. Given what you were told at the beginning in those early years about her future and your future by extension, what does it feel like today to actually be standing here, still loving, still living, still hoping, yet with uncertainty?
It feels good. I had no idea how long and what our path was going to look like sort of post-surgery. Claire is doing quite well. Um, and so that brings me a sigh of relief. I feel like some of these things that we've talked about today of like seeing her be able to like describe her medical condition, advocating for herself, surrounding herself with friends and people who are supportive is all like I feel like a success in my mind. I feel a lot of pride. I think we've done a good job, and she's done a great job of like engaging and really trying to be able to live with a complicated disease. Um, yeah, I think it's I don't I'm not gonna lie, like, there are moments of the day that are deep and dark and scary for me, like, I don't think this is going to be the reality for us forever. There is no cure for this disease. There is, medication that obviously help alleviate symptoms, but there is no cure, and it is a rare disease. So, the realities of a cure are I'm realistic about that. I think, one of the ways that I kind of keep like carrying on or think about the future is continue to be involved. I think organizations like PHA Canada who are advocating for better access to medication. The release of the rare disease strategy recently is like a huge win. Governments paying attention to rare diseases and getting access to medication in rural and remote areas or where there's less access has been really important. So I think I see my part as like raising awareness and doing some of that advocacy work as well as, my work in my family. So I think it's still scary to think about the future. I have no idea what the future holds. I think like a lot of moms think about like I picture like what will her wedding day look like? What will her like family planning look like? What will her work years look like? I think, when I look across patients, adult patients with this disease, many don't work. Um, Fertility and family planning looks very different. So I think there will be lots of hurdles for us in the future or for her, us obviously providing support. So I don't know. I don't want to use the term like out of the woods, but this will be something that I live with my whole life. And she does, and us kind of going through it together. Um, it's not going to ever go away, and just trying to think about ways in which I can carry on and be productive and like, self-regulate and take what I need and give her what she needs is going to be like a lifelong piece of my life that I just is the reality.
It sounds to me, though, that every step along the way has gotten you prepared for the next step that's around the corner. You couldn't imagine. It's kind of like favorite analogy of mine. It's hard to back out of your driveway when you live on the freeway.
Yes.
So all of those steps involved to date have got you ready for what's around the corner because we'll be that much more empowered to take that on.
Yeah, I hope so. I mean, honestly, I remember when Claire was, 3 or 4 and thinking about, "Oh my goodness, like, how am I gonna handle a teenager when she's a teenager?" Like, having to have these really hard conversations and telling her she can't do this and she can't do that, but, I mean, I think it's like I in that moment of when she's 3, you forget that it is an evolution, and she will evolve with me, and it's not just you don't go from 3 to 13. So I think I'm trying to create that same mindset of like, we're not going to go from 15 to family planning. Well, let's hope not. And so it's going to evolve. So I just need to be patient with myself. Going back to that question of like advice you give yourself 10 years ago or 12 years ago is like, just be patient. Like time is on our side and there is no rush to make decisions and get ahead of ourselves. And that is a hard thing as a caregiver. I think you jump to worst case scenario, at least for me. That is kind of my default.
Well, it's hard not to think of the future because we always have that grip on the thinking about what's around the corner. But caregiving must have taught you, and that's what I'm hearing, that it is possible to loosen your grip on that constant thinking about the future without abandoning hope or presence in the
Mhm,
moment.
absolutely.
If you could speak to a parent early on the road, similar road that you've been on, someone who's sitting there in a state of shock, possibly staring at lab results, staring at reports or letters, what would you want the most to hear in that moment from you?
hmm I think maybe two things. One is knowledge is power. I think like don't be afraid to ask all the questions and to really understand what's happening. I think that, I mean, I guess it depends on your personality, but for me, really having the knowledge to be able to help to make good decisions was really important. But I think the other one is like find your people. I think I didn't do this. Like I didn't. I mean, I had a strong social network, but I didn't really look for people who were going through the same thing as me. And I was like, oh, support groups. I don't want to do that, and I don't want to know what the future holds. But I really wish that I would have gotten more engaged in that community. I think that, these organizations that are dedicated to supporting families and patients are like such a valuable resource that can often be really underused. It's like they have peer support programs and group and webinars and, resources and checklists and like all these things. Like I wish I knew about those resources earlier on. I think it would have really helped me. And then I guess the last one would just be like, give yourself some grace. Like it is hard and you're going to have really hard days. You are going to sit in your room and you're going to cry all day. And then you're going to have days and you're going to go out into the world and you're going to function like nothing's ever happened. And I think that is like a totally normal reality of caregiving. You have these days that are really, really hard and you have days that just feel kind of normal. And I think like being on the emotional roller coaster to normalize that, I think is really important. But then to find ways to make that roller coaster less steep, to like try to flatten the roller coaster has been like my sort of like personal life mission. Like living like this is really, really hard. If you the more that you can get off the highs and the lows, I think the easier it's been, at least for me. And I think doing that is through, knowledge, social support, having frank conversations with friends, etc. But I think that's what I would tell a new parent. It's scary. Or a new caregiver, whether it's a child or a partner or etc.
Have you built a sense of peace?
Have I built a sense of peace?
Hmm.
I think so. I mean, if I think about my state of peace now versus 10 years ago, I'm really peaceful. But I think so. I do still have the moments of, why did this have to happen to us? Why me? You know, I wish that she could have an easier life. I have the like comparator of a healthy son, which sometimes I can brings moments of like, ugh, this sucks. um, but I think so. I think I'm almost there.
You've managed to build a sense of peace without ever having the certainty of knowing what to expect.
hmm
And I think that's a tribute to caregivers' abilities highlighted in your efforts and your story to build the life that they want.
hmm
Thank you for joining us today, Cynthia. You
Oops.
shared with us a story of courage, a story of reality, a story of stepping up, and it inspires and it teaches. And we thank you for sharing with us.
Thanks, Mark. Happy to be here.
That wraps up another episode of the Caregivers Podcast. I'm your host, Dr. Mark Ropeleski. We'll see you next time. Before we wrap up, I wanted to remind you of something important. The conversations you hear on this podcast are here to inform, to support, to spark reflection. They're not a substitute for professional medical advice, care, therapy, or crisis services. Listening to this podcast does not create a doctor-patient or caregiver-client relationship between us. If you're facing a medical concern, health challenge, a mental health challenge, or a caregiving situation that needs guidance, I encourage you to reach out to a qualified professional who knows your story. If you're ever in crisis, please don't wait. Call your local emergency number or recognize crisis hotline right away. You deserve real-time help and support. The views you hear on this show, whether from me or my guests, are our own. They don't necessarily reflect any organizations we work with, or are part of, or have worked with, or been part of in the past. This podcast is an independent production. It's not tied to any hospital, university, or healthcare system. Thank you for being here, for listening, and most of all, for taking the time to care for yourself while you continue to care for others. I look forward to hearing from you.